My name is Janelle Cook and I'm the Senior Audiologist and Manager of the JPAC Audiology Centre, commonly known as JPAC. The centre has 6 audiologists and we all work together to provide audiological services. We see children of all ages, from birth through to 18, to children who are referred from the community, to children who are in RIDBC programs and our outreach program. We specialise in children who have additional needs and all developmental stages. The staff are dedicated, experienced, qualified and very interested in the work that we do. If you can't hear, it's harder to learn to speak. So often for children who have speech delay, the first port of call is to have their hearing checked. I think sometimes parents come in with a preconceived idea about their child, and coming in and having a hearing test can confirm, yes, in fact, they do have a hearing loss and that further medical treatment is going to be useful. Why that's great for the family is they know exactly what the problem is, they know the type of problem, they know the degree of the problem, and they can work on a medical solution. For children who come in and who have a permanent hearing problem, we can steer them and refer them on to the appropriate people who will fit hearing aids or cochlear implants if that's decided upon. The joy too of working at RIDBC is that we can also feed them into early intervention programs here on campus if that's the choice of the family. Australia now has newborn hearing screening, so every baby in Australia who's born will have their hearing screened at birth. The diagnosis of hearing loss is usually within the first month or so of life. So if you intervene at that very, very early stage and that everything is okay as far as the rest of the development, those children will progress through a normal schooling system. When we test young children, parents often want to know exactly what we're going to do because they can't imagine how you can test a 12-month-old child. So it's not just one test, it's a battery of tests. Whenever a child comes in, we do a family history. We talk about the child's abilities and the problems the parents might see. We do some otoscopy, that's looking with a light at the child's ear canal and eardrum. We do middle ear studies because a lot of children have undiagnosed middle ear pathology. And then we do behavioural tests. So the testing is objective testing, where as long as the child sits still, we can get the results, and behavioural testing where the child can show us what they hear. So the system that we use is where they will go into the booth. Now the booths themselves are very large, they're very child friendly. We have lots of toys and bits and pieces in there to keep kids amused. The family go into the booth, they'll be working with 2 audiologists. We then do the test. Now young children can be unreliable, they can ignore things. So the way we do it is we have the child often seated on their mother's lap with the mother appropriately instructed not to react to the sound, or they can be seated in high chairs, or if they're slightly older kids, they'll sit by themselves. A sound is presented through a loudspeaker which is at right angles to the child. When the child looks towards the sound, they then receive a reward, and the reward is lights and a puppet. We have a whole range of activities and rewards that we can use for children who are vision impaired or who don't find that sort of visual reward very interesting. So the child goes, oh wow, that's interesting, and the audiologist who will be in the room with the family will distract the child back to the table with whatever task. We go through that process of teaching the child what to do. We then start to make the sound softer. We go down to what we refer to as our pass levels, and these are industry-wide accepted pass levels. We know that if the child can respond to those levels, then the child has sufficient hearing to be developing their speech and language. 2 audiologists makes a huge difference, particularly for children with developmental issues. We hire interpreters if we need other language interpreters, if we know in advance, because it's very important that families understand what's happening and why we're doing what we're doing and what the outcomes will be and what the next step is. If you qualify under a number of different levels, then we can bulk bill you. So the people that we bulk bill are people who can demonstrate that they are low income, children who have a condition that predisposes them to hearing loss later in life. Families who don't meet that criteria will be charged a fee for service, but they will be able to get a rebate through Medicare if they bring their medical referral and their Medicare card to the appointment. So I love doing what I do. The staff here love doing what they do. It's a privilege to work with families and to provide them with good quality audiology services.